This topic has been a topic in my mind that I think needs to be addressed, I think mostly on the federal level, but let me say this. Rhode Island has one of the highest insured citizen rates in the country. So we have the most people that are insured, but we're the most expensive. So I did some checking, and out of the 33 developed countries in the world, we're the highest. We pay the highest for medical. There's something wrong somewhere. We're doing something wrong. I had a conversation with a young lady from my Democratic Town Committee. I won't mention her name, but I had a constituents night one night, and she said a couple of things that made some sense to me. And it kind of stuck with me, and I kind of just kept looking and reading and trying to understand there's a problem that we have to get a handle on. And I don't have the answer to it, but as I indicated earlier, out of the 33 developed countries in the world, 32 have some sort of universal health care plan. Now, it doesn't mean it could be an all-payer system or all Medicaid. They have some form of it. And as a result of that, their costs, the medical costs, are driven down. Now, when that happens, we pay a price on the other end. I'll use Canada, for example. Canada spends a lot of money on health care, a lot. But the drawback is the wait time for certain medical services. So, while I don't sit here and say I'm just totally against it, I think we should look at what works. What works and what people are happy with. You know what I find interesting is all these countries, you never see them trying to change their health care. Why? Because they like it. Something's to be said there. I don't know what the answer is, but I think if we work with our federal delegation, why can't we look into and take pieces of whatever works for us to drive our medical costs down? Because you know what? To pay $400 for an aspirin in the hospital is just ridiculous. And it's killing us. And in this country, the medical costs are extremely high. And I'm concerned about that. So I think it's worth taking a look at, and I hope that our federal delegation in Washington takes a look at all these other countries, what works, what can we piece together to make our healthcare system better and not cost the highest in the world per capita.